Hi everyone, I am Dr. Christine Anderson. My patients call me Dr. Chris. I am a Los Angeles-based chiropractor who specializes in pediatrics and pregnancy and childhood developmental disorders, but really what I'm here to do is to help kids grow up, families and kids grow up healthy. So I am doing this series on reflexes because they play a crucial part in childhood development. And I have already done all the primitive reflexes, or most of them, I should say. Last time I talked about postural reflexes, so we're going to review a little bit of that and check out all of the reflexes, the videos I've done to help your child grow up healthy. So the righting reflexes are a set of postural reflexes. These are more mature reflexes. And I'm going to talk about what can happen if these reflexes are underdeveloped in your child and what you might see and why they might be the cause of things like developmental delay, poor balance and coordination, issues with focus and attention, and memory and sensory issues, maybe even motion sickness and dizziness and poor posture. So let's dive right on in. Just a reminder, these are the videos I've done last time I did postural reflexes, but this all kicked off with the introduction to neurologic reflexes. And I did a whole series on primitive reflexes, doing an overview, and then I went into individual reflexes, and I've made a playlist. So I will put all of that in the description below, and I really highly recommend that you go back and watch these videos because it all ties together. All right, so just a little overview of the postural reflex control system. I went over this on the postural reflex video, but what happens is over on the left there, you've got the sensory input and you see an eye there. So we've got our visual system. You see an ear there attached to the labyrinthine system. That's the inner ear. And you see a leg there representative of the proprioceptive system. So we have receptors in our body that tell our brain, where are we, what are we doing, what is the leg doing, what is the arm doing, and even internal receptors that talk about what the body is doing internally. So there's constant feedback from the outer body to the brain, and then the brain will send signals, in this case to the body, to generate a movement in response to whatever sensory input is coming into the brain. And in the cases of the postural control, at the top there in the yellow is the midbrain. So I go more into what that significance is. And again, those movements that are generated are going to just follow into that feedback system, because you're going to have a movement of the head and the inner ear from gravity. You're going to have input from what's going on, what the eyes are seeing, and you're going to have input what's going on with the body as a response to what the brain was perceiving. So this is the feedback loop that we are talking about with these righting reflexes, which are a type of postural reflex. Now, the difference between these righting reflexes and primitive reflexes is that the majority are going to come on after birth, and they are going to remain for quite a number of years, and some of them even into adulthood. So we want to make sure that these are developed and established at the very latest by age 3.5. And they are going to help tell your brain, pardon me, where your body is. It's going to keep the body upright and aligned. It's going to control balance when you're upright and moving. It's going to maintain that fluidity of movement. It's going to maintain the eyes in a horizontal plane. All of these things are going on with the righting reflexes. So we're going to talk about basically 4 different types of righting reflexes. 2 of them are head righting reflexes, the Labyrinthine Righting Reflex, Optical Righting Reflex, also known as the body head reflex or oculo-head reflex. So lots of names there for that one. Then there is a neck righting reflex and then a body-on-body reflex. And then I've added in the Landau reflex there, which I have done a video on already in the primitive reflex series. It's not truly a primitive reflex because it comes on after birth, and it's not truly a postural reflex because it is supposed to be integrated by 1 year of age, so it doesn't remain for a long time or throughout the life. So we term it a bridging reflex, and it's important just to know where it fits into the scheme of neurologic development. All right, so let's begin with the Labyrinthine Righting Reflex because this is one of the first ones to appear, and it's also one of the most important ones because of this occurring at 2 to 3 months. It's going to remain for life, so we all have this, or we should, and it's going to be strongest at about 10 months of age. So if you have a child who's 10 months, this should be really, really good, as you're going to see in a minute. The difference between this one and the next one is you're going to see in the picture there, the baby's blindfolded. So you can't tell a baby to close their eyes and do this. And why that occurs is that you are taking out the visual component and you're just looking at the labyrinthine system, that vestibular system that is responding to what the head is doing in gravity. Is it forward? Is it back? Is it rotated? So there's an XYZ axis, and based on what you are doing with the body, so you can see here as the baby is tilted to the side, their head compensates to keep the eyes and the head as level as possible. So the head doesn't tilt along with the body. And this is going to help orient the head in space when the baby's on its tummy, because as the body is kind of down on the ground, the head is going to lift. So this occurs with holding the baby and tilting side to side, and also front and back. So as you tilt them forward, their head is going to go up. As you tilt them back, the head will go down. So it responds to try and keep everything level. Now the next one is the oculo-head or optical righting reflex. This is the one that has all the names. So you're going to see that picture. If you are familiar with that face, it's J.P. Sears. And so I was watching a video of his, and it was something to do with, the vision we all have with having children. And then once you have a baby, how things are a little bit different than you might imagine. And look at that perfect righting reflex right there with his baby. As he's tilting the baby to the side, the head is maintaining that levelness. The eyes are level. And so this is due to the visual input that's coming in. So the first one, the eyes were blindfolded, so it was just the inner ear. Now we have both. We have inner ear and the visual input so that the brain knows how to keep that head level. So this is really important because we're going to, as we develop, we need this input to develop optimal eyesight because we need our head to be stable and have good head control so that when we're moving our body and our head, we can still fix and focus our gaze on something. And this really, really becomes important in things like the schoolroom and learning and reading and this type of thing. And also so we don't get dizzy and have motion sickness. So this is how this all kind of ties together. All right, the neck righting reflex comes on a little bit later. And this one is going to actually integrate at about 5 years old. And usually there's not so much problem with integration unless there really is a major brain issue. It's more about this not coming on in a timely manner at 4 to 6 months, maybe 7 months, but we really do want to see this. And so what is going on here is as you have the baby laying on the back, as you can see in the diagram, the baby's head was turned to the left, and as the baby's head is turned to the left, the whole body rotates as one piece. And then this is how they eventually go from laying on their back to on their stomach. So this is part of this initiating rolling over. It is so important. Now, the only way that this can happen is if the baby is on the ground and they go to turn their head to look at something. So you've got some toys, or you've got like one of those little play gyms, and they turn their head to look at whatever they're looking at, and the whole body will follow. And before you know it, they're on their tummy, and it's like, whoa, what just happened? So initially, the whole body goes in one piece. As time goes on, as you get more to like 7 months, then they can turn their head, and then their trunk, and then their pelvis in a segmental fashion. So that's a little bit more mature than the full-on neck righting reflex. And later on, once a child has mastered rolling over and they're up and they're walking, this righting reflex will help with smooth running and jumping. So super important for that coordination and balance, right? And then we have the body on body righting reflex. Again, this occurs about 4 to 6 months. Usually it's going to integrate about 5 years. And in this one, what's happening, starting at the right-hand side of the picture, you can see the baby's left knee is being bent up to their body, and then it's brought over to the other side of the body. So, you know, like you try to do a spinal twist in yoga, that type of thing, right? But as you bring that knee up and over, then they are going to start to take their whole body over, and it's going to help maintain their head and body alignment. And again, this is an important precursor to rolling over and also sitting up and then standing. So super important reflex that we want to see occur at this time because of the milestone development. So babies should be rolling over around 4, 5, maybe 6 months at the latest, and then starting to sit up and prop themselves up and getting on hands and knees and starting to crawl. So it all ties in together. This neurologic system that we have is so amazing that it's built in there for this to occur. And this is why I say milestone development is not arbitrary. It's not, oh, the baby will roll over or crawl or whatever whenever they want. This has to do with neurologic development. And if it isn't occurring on time, you want to get on it right away. You don't want to wait and see, because then that problem is going to escalate, and then there's going to be further delays. And if it's really not taken care of, then you're going to have an older child with issues, as we're going to see. All right, last one for these righting reflexes is the body on head righting reflex. And again, this is occurring about 4 to 6 months. It integrates by 5 years. And this is going to, again, if the baby's on its tummy, is going to aid in the position to get up onto hands and knees and crawl. So whatever position the baby is in, if they're on their tummy and the pressure is on the front of their body, they're going to lift their head away. If they're on their back and the pressure is on their back, they're going to lift their head up. And so this is where they start to, you go, oh, it's like a little baby sit-up. You can see in this picture the baby has the blindfold on because we are taking out that visual aspect. Now, obviously, you're not going to blindfold your baby, but if you want to check and see for the visual aspect, you keep the blindfold off. But if you want to take that aspect out of the test and see what the vestibular system is doing, then you need to do a blindfold. I usually just look at this as the baby is moving. And I'm not typically blindfolding babies, but this is just to kind of help explain how these systems work. All right. So just a quick mention on the Landau reflex. Please go to the video that I did explaining all about this one. It's the airplane reflex. And so this first part of the head and chest lifting up is around 2 to 4 months. And then the legs start to lift up after that. And this should integrate at the very latest at 2 years. I like to see it at 1 year. So this means that they can keep their feet down and lift their head and chest up if this reflex is integrated, which we want it to be. All right, so what happens if these postural reflexes, if the righting reflexes are not developed? Then you're going to see things like your baby having poor head control. All right, they're having trouble holding their head up. And then the older child is going to have trouble with posture. They'll probably slump in the chair. They might lay over their desk. You're like, sit up straight. It's just like, I can't. It's too hard. I'm tired. They are probably going to have a delay in milestones for those very reasons I talked about, because these righting reflexes are necessary for those milestones to occur. The other problem is that this connection of the eyes with the vestibular system, so if these righting reflexes are not occurring, then the eyes are going to be out of alignment, and they're going to have to adjust what's going on with their eyes and the eye muscles and accommodate what's going on with their eyes rather than with the tilt of their head. So if they tilt their head over as they tilt their body over, the eyes are going to have to move to balance it out, or it just is not, the brain goes, I can't function this way. So they might also have dizziness if they have this going on where they can't focus near and far. So they try to focus near and the black background gets blurry, or if they try to focus far, the foreground gets blurry. And so it's really hard for them to go back and forth. So this would be like copying from a board, right? It's going to be very, very difficult. And they're going to get possibly dizzy doing this because of the movement with either the foreground or the background. And these are the kids that really don't have eye issues, but they get glasses when really what they need is some remediation with these righting reflexes and getting them to get turned on. So again, you're going to see the difficulty reading with eye tracking and movement, poor balance and coordination because of the vestibular system and the proprioception not being integrated. And same thing with the poor attention, focus, and visual memory. They'll probably skip words when they're trying to read. They're going to write their letters backwards, so you might think they're dyslexic. They can't copy notes. They might have poor handwriting. They're going to struggle with spacing on the page. They're not going to be able to remember things they see visually, so things they read or see. They might get a diagnosis of ADHD because of this lack of attention and focus and memory. So this is why we have to go back and look at this neurologic development. And if we can take care of what's going on there, then some of these things may end up disappearing or at least getting better. All right, and by the way, you have a better chance the earlier you get your child in. After age 10, it's much harder to make changes. I still can do it, but it's so much harder. The earlier that you get your child in, and really, I prefer to see babies right after they're born and follow them through in that first year of development to make sure their primitive reflexes all get integrated, and then through the next couple of years to make sure these postural reflexes are developing. So what do I do when a child comes in and they're having issues? Well, I'm going to, of course, check their primitive reflexes and see if there's any retained primitive reflexes. So go back and watch all those videos. The other cause why this might occur is that children are often put into devices, or what I call contraptions. Now, there's necessary evils. We've got to put them in a car seat in the car, but once we get them home, get them out wherever you're going. It seems quite often you just take the car seat and you plop it. It becomes the stroller, and they sleep in it because they fell asleep. Or there's jumpers, and I just had a 3-month-old come in yesterday, and I was like, what is going on here? And I'm like, what position is she in? How much floor time? Where is she during the day? And the dad said, she likes the jumper. And I go, no, it's not going to be good for her at this stage. She needs to have her floor time and her tummy time for the development of all these things, because if babies are in contraptions, they cannot move their body adequately. They can't do the neck righting reflex if they're sitting up in a chair or in an incline or in a swing. They've got to be on the floor. And early on, you can do tummy time on mom or dad's or whoever the caretaker is on their chest. Just lay down and they can lift their head up. And as that gets stronger, then they can move to the floor for small amounts of time, getting longer and longer, but multiple times in the day. They basically should live on the floor. This way, they're going to get adequate sensory and proprioceptive stimulation. Touch, sight, sound. What's that sound? They're going to move their head, their body's going to follow with the neck righting reflex, and they're going to turn over. And it's like, whoa, okay. The brain goes, wow, okay, so if I do that, this is what happens. And then they can keep doing it until they can do it when they want to do it. I have subluxation and cranial restriction on here because this is my world, and this is what I can do to make sure there's no restrictions to that communication. Remember that postural reflex control loop, okay? We go from the outer body, the sensory system, to the brain. If there's interference there in those nerve connections, the brain's not going to get the right stimulus. Or the brain sending signals out to the body to move. If there's a problem there with interference, it's not going to get the messages, and then that feedback loop gets disrupted. So this is where I come in with subluxations, which are misalignments in the spine, and especially the levels that are going to the muscles that are needed to do this movement, as well as up at the top of the neck, which is where the brainstem is. And then the cranial restrictions, which involve the entire spinal system, the craniosacral system. And I'll put a link to the video I did about craniosacral therapy and babies or newborns or something like that. But it applies to every age. But it's important for people to see how gentle it is for their babies so that they're not afraid to get this done. I put torticollis there as well. This is where babies come out of the womb and they might have a head tilt and the head rotated. And this again is a chiropractic issue that has to do with subluxation. So chiropractic is great for this. And usually there is no at-home stretching, but if their head is turned this way, it's going to alter the way the messages are sent up to the brain. So this is why we want to take care of this, because it can affect these righting reflexes. Because if they can't turn their head their other way, guess what? They're not going to be rolling over the other way either. So important. All right, so what can we do for these kids who are not developing their postural reflexes? Well, like I said, I evaluate primitive reflexes, give exercises to get those integrated. We've got to build the basement, which are these primitive reflexes, which are the bottom part of the brainstem. Get your child moving, get them active. They've got to have that stimulation of their sensory system, their vestibular system. They've got to move their bodies in all planes of action: spinning, tumbling, rolling, running, jumping. All those are going to help actually with these reflexes. I am a functional neurologist that's trained in childhood developmental disorders. That's my FAB CDD. So I can do some things remotely, but if there's hands-on work that needs to be done, I can try to hook you up with somebody in your area. So you want to try and find somebody who understands functional neurology as opposed to medical neurology, which is there's a pathology or disease that needs to be taken care of. That's not what this is. This is developmental. All right, so I talked a little bit about chiropractic care and craniosacral therapy. Let's talk a little bit about some of the exercises. So for the righting reflex, you want to do some things with your child looking at objects. So you want their head still, and they're going to like move their body while they So you can hold their head. It's hard to do on my own. And they move their body as they try to keep their head still and their eyes focused forward. Or you can try to have them keep their head still and move their body side to side. So you have your hands on their shoulders and push them side to side to see if they can kind of keep their head still so it doesn't tilt. So it's a conscious movement. Doing things with them like cobra and up dog yoga poses if they're older. If they're a baby, you can get them on an exercise ball so that they've got some room to kind of push up there, and you can hold a toy up for them to look at, or maybe have them put some paper on a wall and have them draw on the wall if they're on the ball. So just getting those things where their body's trying to be flat and they're looking up. Primitive reflex exercises, of course, especially the lizard for the asymmetric tonic neck reflex. I'm going to put that reflex video in there so you can go back and look at it. And spinning in all directions, upside down, side to side, round and round, whatever way. Spinning is so good for all of us. And we don't do it enough as adults, and we kind of lose that joy of spinning. But if they can handle it, if it makes them dizzy, then it might be something they have to build up to, where you go slow first and then go faster and faster. All right, so this is where you find me, losangeles-chiropractor.com. I've got a lot of things on my website. I've got the links to all of my YouTube shows, podcasts, all those good things. And I can do a lot of things remotely, thanks to the great aspect of FaceTime and Zoom. So I can basically, my eyes are there even if my hands aren't, and have you be my hands for doing some of these things for the evaluations, and then we can work together with exercises. Or come on into my office. I've got plenty of things to do there, as well as the bio and neurofeedback, and of course adjustments and craniosacral work. And for those of you who don't live in LA, I also do the interactive metronome, which helps with balance and coordination and timing of the brain. That's the I Am Home, so definitely I can work with that remotely. And I have done a video on that I will put a link in the description. So, I hope you liked this video. If you did, please give it a thumbs up, subscribe, hit the notification button, share this with your friends. We need to get this word out. I need your help, because our children's, their health really depends on their neurologic development. And this foundation will help set everything up for so many families so that they don't have struggles, they don't have problems. They're not having so much issues that they can't just relax and enjoy their life. So thank you so much, and I will see you next time where I talk about equilibrium reflexes. Bye now.